Welcome to Seattle Children's virtually. I'm very excited to bring a great, fabulous group of folks from our Rehabilitation Therapies group together today to speak with you. And I will, since our time is short, go ahead and pass it over to Katie.
Hi. Thanks so much all for coming to our presentation. So today you're going to hear from a variety of therapists who work in the rehabilitation department at Seattle Children's Hospital. So these therapists are physical therapists and physical therapy assistants, occupational therapists, and speech therapists or speech language pathologists. So throughout this presentation, you may hear us say PT for physical therapist and OT for occupational therapist, and SLP for speech therapist or speech language pathologist. And my name is Katie Chan, and I am a PT, and myself and Beth Felker, and I'm sorry, Shauna, you can go to the next slide. Myself and Beth Felker, who is an SLP, are going to get this presentation going, but you will hear from the rest of our lovely colleagues, as you can see here on this slide, as our presentation continues.
All right, awesome. So my name is Beth. Like Katie said, I am a speech language pathologist on the acute care side here at Seattle Children's. When we were thinking about how we wanted to do this presentation for you guys, our thought was, how do we make this as functional and kind of relatable as possible? And so we wanted to do a case study to kind of really delve into some of the things that we focus on in a really applicable way. So our case study is a 12-year-old girl who had a brain tumor. And before she had her brain tumor, she was doing everything normal, talking, eating, running, dressing, using the bathroom. And then unfortunately, she got sick and had this brain tumor. And so we're going to kind of talk to you guys about how therapies will work with a patient like this, and then what kind of it looks like for each discipline.
So our case study, let's call her Molly. She found out she had a brain tumor, and so she had her brain tumor resected or taken out. And following her resection, she is going to stay in the hospital. And so while OT and PT and speech, we all see patients like Molly pretty frequently. We also wanted to let you guys know that we also see kids all over the hospital. So for instance, we see kids on the medical unit. Let's say a kid gets a pretty intense cold and just needs a few more days of observation and care. And we'll see those kids on the medical floor. We also see kids on the surgical floor following like a broken bone or a transplant of an organ. And we'll also see kids on the PICU and the SICU. So that's the pediatric intensive care unit and the cardiac intensive care unit. And those are kids that just might need a little bit more medical support. And we also help their functional mobility and speech and self-care or self-care skills in those settings as well.
So when we're kind of thinking about patients that are still on the acute care side, their main goal is really to get their health and care managed. And so getting them into a really kind of stable medical picture is the main purpose of being in the acute care side. And so therapies are really important in this part, but the main purpose is to get them stable from a medical perspective. And while they're doing that, therapy, speech therapy, OT, and PT kind of help the team to improve the patients' their outcome while they're here. So we're working with them in monitoring how they're responding to different things, and all in the context of trying to get them more stable from a medical perspective. Because the main purpose is to just be getting their kind of health kind of a little bit more stable before they would transfer over to the inpatient rehabilitation side. Oh, sorry, go ahead.
So let's say Molly spent about 7 days in the more inpatient acute care side. And then she was able, like Beth was saying, to get a little bit more stable, medically stable, and was ready for those intensive therapies. And so now she has transitioned to inpatient rehab.
And so here the focus now switches from the medical kind of medical side doctors, medication management, monitoring changes, that's no longer the main purpose of the inpatient stay. The main purpose now is really to improve her skills, and so she can kind of get back to a more get closer to her baseline of things that she was doing before. And so she still needs a lot of help from a medical perspective, which is why she's still in the hospital, but she's stable enough, and those things can kind of be monitored and worked on while she's getting more intensive speech, PT or OT, to meet kind of those functional goals. When we're thinking about inpatient rehabilitation, the main purpose is really to get the patient to be able to safely discharge from the hospital and enter back into their life. And so while this patient, Molly, for example, is on inpatient rehab, if we're thinking back to her, patients that have had a brain tumor resection often have difficulty with their thinking, their swallowing, their mobility, their self-care. And so for her, we would want to help her with those things. So thinking about her expressive and receptive language. So receptive is how she's understanding, and expressive is how she's talking. So as a speech therapist, we can help support her functional ability to communicate while she's in this acute phase of, right after her brain tumor resection, giving her strategies to think of the right word, giving her strategies to be able to say the word more clearly, using pictures to help support her language, so she can tell her parents what she wants to eat or what she needs, if she needs to go to the bathroom. Another thing that speech therapy works on, especially in a case like Molly's, would be that higher level kind of cognitive skills and their attention and memory. And so we will give strategies like memory binders, or work with patients on kind of writing things down to help support memory. And then lots of different strategies to help with those kind of more broad cognition. And then the other thing that we work on is eating and drinking. So sometimes patients that have had an injury, like a brain tumor resection or many things, they have what's called dysphagia. So it's difficulty swallowing. And so for her, we would work on giving her strategies to improve her swallowing, changing the diet level that she's on so she can maybe eat things that are more safe for her, so she's able to eat and drink safely, and also meet her calorie and her hydration goals.
Moving to physical therapy. So PT, or physical therapy, really focuses on helping to build strength, to increase stability, and focus on movement and function. So in Molly's case, let's say she gets to inpatient rehab, this setting that we're talking about now, and she has a really hard time with balance in both like sitting and standing. And so PTs have a lot of techniques to help Molly's balance progress. And so that would be like the first step that we work on, is really helping her increase that stability in both sitting and standing. And as her balance progresses, we can then progress to working on things like walking and moving more independently. And so one of the things we really like to focus on is, how is Molly going to access her community in like a safe and a dignified way? And so sometimes that could look like how you or I walk, and sometimes that could be through different types of equipment, such as a custom wheelchair or use of a foot or an ankle or a leg brace. And we also think about assistive devices like a cane or a walker or crutches, to really help and focus on progressing Molly's independence and the access that she has to her community and to do the things that she wants and loves to do. Moving on to occupational therapy, which is the third therapy that we really focus on in inpatient rehab. And OTs really focus on helping patients with tasks and activities of daily living. So things like eating and bathing and getting dressed and using a tablet or a phone. So let's say Molly comes to inpatient rehab and she has really a difficult time controlling her arm. And so that makes things like getting dressed and going and using the toilet pretty difficult. And so OT can really work with her on progressing her arm strength and her arm and motor control of her arm, and then teaching her different ways to do these things or do getting dressed and using the bathroom. And one of the other things that I love that OT does is they really work with adapting things and adaptive technology. So let's say Molly like loves to use the PlayStation, but using that typical PlayStation controller is really difficult for her. And so an OT can work to adapt that controller so that Molly can still access and play the games that she really loves to do. So let's say that Molly spends 2 weeks in inpatient rehab, this setting that we're talking about now, and she progresses well and she meets all of her short-term goals that were set for her and with her and her family at the beginning of inpatient rehab. And so now she has met her goals or her short-term goals. She's safe to discharge from inpatient rehab from the hospital, and she's safe to go home. But even though she's safe to go home, she would still really benefit from therapies. And so she would be set up with outpatient therapy, which is another setting that we work in.
Thanks, Katie. So I'm Carrie. I'm a physical therapist assistant, and I primarily work in our outpatient setting at Seattle Children's. So as Katie was saying, you've left the hospital, but you're not quite back. Molly's not quite back to doing what she was doing before, and we want her to be able to fully participate in her life and her recreational activities and in school as much as possible. So that's where we're really coming in from the outpatient perspective. How can we get you back to doing those things that you love and to fully participating in your daily life? This, depending on what's going on for Molly, it's probably going to last for as long as she has her cancer treatment for that tumor. For other people, it might be a few weeks, a few months, or it could be, in this case, maybe even a year or two. And another thing about outpatient therapy is you're coming to us maybe an hour a week for each of these different therapies. And so a big part of what we do is help give the patients something that they can do at home. Because there's a lot more time in the day when you are not in therapy than when you're in therapy. And so we're helping you to develop a home program, or helping the patients to develop a home program so they can continue to move towards those goals, whatever they may be. Sometimes this kind of therapy can happen in a school. So if the goals are really specific to the school, so being able to stand for a certain amount of time for a certain kind of technical skill, or being able to write in a certain way, or to speak more clearly, that could happen in a school setting. And we do have school therapists. It could happen in an outpatient clinic, which is where I work. And that's where we really try and find ways to make it fun. How can we use games, be creative, and find different ways to engage Molly and our patients to progress without it always feeling just like exercise, or just like, I got to do this 10 times, for instance. So we might do an obstacle course if we're working on balance. So you have to get over this and under that and around that while holding your balance. We might mimic things that they're going to do in normal life, as Katie and Beth had mentioned. A couple of other ways that outpatient therapy can be delivered is through home health. And so that's where we go to a patient's home. Either they or their parents might not be able to leave for some reason. So we actually are going to go into the home, see what's there, and make a session happen in their home environment, which actually can be really helpful to see where they're having difficulties and how we can really target our interventions to help them meet those longer term goals. And finally, early intervention, which is also called early support for infants and toddlers. And that is really for kids who are between the ages of 0 and 3. So not our Molly, but another support that is there for kids who need these on an outpatient basis to help them, stay active and successful during their childhood. So Molly has kind of gone through all 3 phases of therapy, with speech, occupational therapy, and physical therapy, really helping her to kind of get back or as close to her baseline as possible, trying to use interesting and fun ways to help her return to her prior level of function. And that's a broad overview of our kind of 3 phases of treatment that we do for our therapies here at Children's.
Hi, everybody. So I'm an occupational therapist, and I often wonder if you have any idea what occupational therapy is, and why do we say occupational? It sounds like we're getting you a job. And that is what some occupational therapists would do. But I like to use the way to think about it as the activities that occupy your day. You you get up, you get dressed, you eat, you brush your teeth, you go to the bathroom, you take a shower. All of those things are your personal occupations. And then again, you go to school. So that's another occupation. That's your job as a student. When you get older, or maybe you are getting jobs, so that might be your next occupation. So, and for little kids, their occupation is learning how to grow and how to develop. And so I work in the outpatient setting here at Children's, and I was an occupational therapy assistant for 17 years. So I had that 2-year degree and I worked for a long time, for 17 years as an occupational therapy assistant. Then I went back to school and I got a higher degree, a bachelor's degree at that time. Now you have to get a master's degree to be an occupational therapist. But so I have been doing that now for 27 years. So I've been an occupational therapist for a long time, and it's always been rewarding for me. Every day is different, and that's what fits for me. I love it. I just, something to think about. So take care. And now I think Audrey's going to talk.
Sure. Thank you. Hi, I'm Audrey DeSoto. I'm a speech language pathologist. I am also in an outpatient setting. I work in our South Clinic location, which is in Federal Way. And I was excited to share about kind of how I ended up here, because I actually did not even know what speech pathology was until I was in high school. My whole life, I thought I was going to be a teacher, and that passion just kind of went to whatever I was learning about at the time. So started to play the clarinet in 5th grade. Oh, I'm going to be a music teacher. And then I had a friend who knew ASL, and I was like, oh, I'm going to work with special education students. And in high school, our senior year, we had a requirement to write a 10-page research paper on an occupation or a degree that we wanted to study. And I chose special education. And so part of that was job shadowing at a local school. And I think it was pretty serendipitous that was the day that classroom was going to see the speech pathologist on campus. And she was just talking to me and sharing more about what she does. And she just encouraged me to be a speech pathologist instead, and to get to work with similar patients, but just in a more variety of settings. And I wish I knew who she was, because it really set me on a new path. And so I did my undergrad and grad work in speech pathology and speech language pathology, and I have loved it. I actually spent the first 5 years of my career in the school setting. And so I think that's what I really love about our job, is that you can never really get bored when you're kind of needing something new or something different. You can change your setting. You can go from schools to healthcare, private practice to the hospital. There's just such variability, which I really appreciate. So I was originally in the elementary schools for a while, and then I did a year in a high school setting, and then moved to Washington, and have been at Seattle Children's for almost 2 years now. I think the most rewarding thing for me is communication is such a vital part of our relationships with other people, and to see relationships between parents and their child, or between siblings, or between kids and their peers just really blossom as they learn how to talk about their day, or say I love you, or tell a joke, or just get mad about something as you're learning about what they like and what they don't like. It's just really rewarding to watch those connections happen between people as their communication skills grow.
Thanks, Audrey. My name is Keren. I'm also an occupational therapist like Peggy, and I work on the infant team here. We see babies from birth to age 1 throughout the hospital. So I'll tell you a little bit about how I became an OT. When I was in high school, I really enjoyed my anatomy class and human body things, like the athletic trainer class. But what really got me was my grandfather lived with us, and he's from Argentina, we're from Argentina, so he only spoke Spanish. And towards the end of his life, the doctor had prescribed physical therapy to come to the house to work with him. My grandfather was having some depression and other problems, and so I would join the therapy sessions to interpret for my grandfather. And I saw my grandfather just kind of come to life. He would get dressed again like before. He would walk to the mailbox. He would get his old leather wallet. And I just kind of felt like, oh, there he is again, you know? And I was just like, wow, this is what therapy can do. Therapy can help bring someone back out of a bit of a funk, physically help them stronger, help them communicate. And so I knew I wanted to be a therapist, but I wasn't sure what kind. And so I met with the dean of the College of Health Professions at the college I was going to. And she told me that occupational therapists work with babies in the NICU, which is the neonatal ICU, with small babies. And so I said, oh, that sounds fun. I'll do that one. And so that's how I initially was interested in OT. And then learning more about it, I learned, that it really is a good fit and it's the right one for me. I will tell you, she's wrong, that it's not just OTs that work in the NICU. All three health rehab professions work in the NICU and with babies, but it's definitely been my passion to work with them. And so since you've learned a little bit about therapy with an older kid, I'll just give you a few examples of the things we do with the babies, because a lot of times babies, people wonder, what kind of therapy can you do with them? So we do all the developmental treatment, like working on sitting and rolling and crawling and getting stronger. But also a lot of times babies have trouble feeding, like when they're born prematurely, or if they have an illness or a surgery. And so we help babies with learning how to feed and teaching their parents how to feed them. So it's a very rewarding job. We say all the time, like, I get paid to help babies eat all day, and that's pretty ridiculous. And so I love it very much. And it is one of those jobs that you may not know is out there and that you enjoy. So happy to join you today.
If you could imagine yourself, your 16-year-old self, say, or high school, what is something that you, as you think about your career trajectory now, what's something that you wish someone had told you when you were 16?
I think for me, there's this immense pressure when you're graduating high school that you need to know exactly what you want to do for the whole rest of your life for the next 40, 50 years that you have to work. And I think I would just encourage you that it's okay if it takes you some time to find things that you're passionate about. It's okay if you're passionate about something and then you change your mind later. I think just as a student, there is just so much pressure that I wish I could have told myself to let go of some of it, It doesn't have to be that stressful, and learning about what you're passionate about should be fun. And so just to give yourself grace as you figure out what that means for you.
Thank you, everyone. I think we are at time. I did just put in the chat for anyone who's attended this session. If you have, there's a link there to the survey to provide feedback on this session. We really want to thank everyone for joining us this afternoon. If you thought this was interesting and you know someone who maybe might find it interesting, we should have a recording up on the Cadence platform at some time in the near future so that you can view this. And as mentioned in the beginning, this slide deck, along with some additional information about each of these occupations, is available on the Cadence platform. You can find it on our sponsor page for Seattle Children's or any one of our speaker profile pages. We have this deck available to you. So please do a little bit of review and digging if you want to learn more. And best of luck to everyone. And thank you so much for joining us today.